This afternoon, tough questions for officials of a state agency facing allegations of widespread fraud. Lawmakers at the state capitol pushing about how the human services system will serve the people who need help as their providers are investigated for fraud. Lou's here now with the latest on today's testimony.
Lauren, DHS Commissioner Shireen Gandhi says they are already implementing some of the recommendations fraud czar Tim O'Malley made in his report and discussing some of the proposals made by Governor Walz. But the main focus today was on how to make sure that those who really need the services don't fall through the cracks. As the fight against fraud within Minnesota's Department of Human Services continues, state lawmakers in the Senate's Human Services Committee asked what's being done to make sure those who need Medicaid services continue receiving them.
We have to be assured people with disabilities are safe. And I've said that in multiple hearings over and over.
In December, KARE 11 reported the death of 60-year-old Ronnie Williams, whose body was found in his apartment several days later. Williams was receiving care through the Integrated Community Supports, or ICS program. DHS had just cut off payments to Williams' provider, Relief Health Services, as the department investigates fraud claims. The committee was frustrated they didn't get clear answers on how many companies are currently in that same position, as well as how many potential people like Williams who need help.
How many different companies are on withholds due to allegations of fraud?
I don't have the exact number as of today, right? The number varies from day to day. What I do know is that it was 540 people and businesses in calendar year 2025.
Am I misreading that? But I get a quote from last year, and I'm just like, that's not what I wanted to hear.
KARE 11 Investigates has shown multiple examples of real people in need of services like integrated community supports who've been affected by the actions of fraudsters. The DHS commissioner and deputy commissioner told the committee the department has two different teams working on continuity of care for people using integrated community supports or who are in provider settings that have payment withholds.
We have to balance both rooting out fraud and making sure people have access to the services that they deserve.
Now, a couple other topics that came up today. Gandhi said that she would support legislation that will give lawmakers an unredacted version of that audit that was done by Optum so that they can pass needed legislation. Remember, most of it was blacked out. And as to the question is whether anyone at DHS has been fired because of fraud or for fabricating documents, as was revealed by the legislative auditor, Gandhi said that she can't answer that until the appeals in such cases are done. Lauren.
Okay, so back to the people who need services. They have some estimate around 500 some people whose payments have been cut off, providers. Do they have any idea how many people were actually getting care from those folks?
No, and that's what they were frustrated, the lawmakers were frustrated about, because that 540 number, that's not 540 companies. That could be like a company and 4 of its workers. That's 5 of the 540 right there. And so these companies, however many there are that have their payments withheld right now, they had real people that need help on top of the alleged fraud that they're committing. And so how many people does that mean? We don't know, even after this hearing today.
Yeah, and how do we help them if we don't know how many and who they are? Lou, very frustrating. Thank you.